Hello. Welcome to Kindly Neurodivergent with Kay. This show is to spend quality time with each other, kindly discussing the similarities and wide range of differences we experience. The experiences we discuss on this show are for educational purposes only. Please do not substitute for professional medical advice, diagnosis, or treatment. Before we begin, I respectfully request that if you witness any pauses during this show, please continue watching. I'm composing a spontaneous comment or question, someone processing their thoughts, in addition to repeating something that was unintelligible or misunderstood. It is natural discourse, and we can choose not to say anything while this is occurring. Today I have Helena Carrasquillo and Michelle Jefferson here with me. They will be discussing mental health and wellness services. Helena Carrasquillo is the lead provider in the Office for Disability and Accessibility Services, where she champions equitable access for neurodivergent students and those facing mental health challenges. With over 20 years in higher education, Helena also co-chairs her campus mental health coalition, developing wellness programs and connecting students with key resources. Michelle Jefferson is a licensed clinical social worker and therapist with over 2 decades of experience supporting diverse populations across schools, justice systems, and community settings. She specializes in trauma-informed care, EMDR, cognitive behavioral therapy, and motivational interviewing. Currently pursuing her doctorate in social work, Michelle is deeply committed to reducing stigma in communities of color and mentoring future practitioners. Welcome.
Thank you for the introduction.
Yes, thank you, Kayla. Thank you for inviting us. How are you today?
Awesome.
Please introduce yourself.
Well, my name is Helena Carrasquillo, and as you said, I am the campus lead for the Office for Disability and Accessibility Services at CT State Capitol Campus.
My name is Michelle Jefferson. I am the wellness counselor here at CT State Capitol, and Helena and I are in the Equity Suite, and we are just a few doors away from each other.
Yes.
What is mental health and wellness, and why is it especially important in a college environment?
Mental health and wellness is super important in a college environment because that's part of a life transition, right? Like we go from high school, typically, not all the time. We know that's not everyone's story, but the regardless, that's a transition, regardless of your age, regardless if you're coming straight from high school. So a lot of times in life, when we have life transitions, we do need some support. So, someone can come see me, a student can come see me as long as they are currently registered and Capitol is their home campus and they are attending classes. So it's usually in the fall and the spring. So overall wellness, right? So having someone to talk to, maybe helping them process some stressors, some anxiety, maybe some depression they may be experiencing.
What is mental health?
So for me, mental health is a part of whole body health. A lot of times mental health has a stigma behind it and people assume that, oh, no, that's not me. I don't have any mental health. But everybody, it's a part of your whole body health. So as people go to the doctors, right? You go to the doctors for your checkup, right? It's okay to see a mental health professional and you don't necessarily have to be experiencing depression or anxiety. I think everyone should see a therapist, but I'm a little biased, right? So to me, mental health is whole body health. We're all, I look at each, we're all like a piece of pie, right? So mental health is a slice of that pie. So in order to have that whole body, overall wellness, your mental health is super important.
I agree for sure.
Why do you feel that way?
Let's see. Why do I feel that mental health is important? I think that, oh,
Why do you feel that every person should see a therapist?
I think that every person should see a therapist at least at some point in their life, right? Depending on what's going on, you may not have the time to, but I think at some point, even therapists should see therapists. It is important to have somebody provide unbiased opinion because you do have your friends and family, hopefully, right? That's a part of your social supports. But sometimes it's difficult to provide an unbiased or give an unbiased opinion or suggestion if if I've known you most of my life, if I've seen you at your worst. Sometimes family could be like, well, we already talked about this, or you said this before. So I think a professional should be providing some unbiased and help you navigate that part of your life. A therapist should not be giving you this, how can I say this, they should not be telling you what to do. They'll help you navigate how to get there. It's always good to have somebody to talk to and bounce ideas off and process things.
So, unlike disability services, you don't need a diagnosis to work with you.
You are correct, Kayla. Yep. So, unlike disability services, you do not need a diagnosis, nor do I diagnose as a wellness counselor at CT State. So, any and everyone as a student, if they are registered, currently registered and attending classes in the spring or fall, they can see me. They can stop in. They can just meet with me and get some information. Decide, yeah, no, this isn't for me, or oh, I already have a therapist that's working with me on this, or if they are experiencing a mental health emergency. So they do not need to have a diagnosis. Yes, you are correct.
Helena, why is that different?
Why is that different? Um, hmm, that's an interesting question. So I think with regards to the supports that our wellness counselor is offering, right? It's meant to be an overall student support, right? So any and all students should have access to that. Versus the disability and accessibility office is just that, right? Is making sure we're leveling the playing field for those who otherwise might be locked out of their education, right? So with disability services, we're identifying those who have a diagnosed disability and can support that through documentation.
But what if the disability doesn't rise to a diagnosis?
So with a disability, if we're talking about accommodations, right? The way to identify a disability, right, is if it has an impact, right? So there are certain cases where the individual is impacted in one or more major life areas, right? But also, funny enough, one of the other factors is if you have been perceived as having such an impairment, right? And so that's a little less known identification of someone with a disability. Um, and so we can provide services in those cases. And in other cases, there are students who come in and they're just going through a particularly difficult moment in their life. It might be temporary. And so we may be able to, through a self-disclosure process, provide some temporary accommodations. So there's always exceptions. It's always an individualized situation. Mhm.
What kinds of mental health and wellness services are typically available to college students?
So at CT State, some of the mental health and wellness things that are provided, resources, we have activities that we do on campus amongst the larger campus. We have smaller, not as huge, like we have Fresh Check Day, right? But we may have events where we may have a guest speaker come in. We've had someone come in and do yoga activity. We have some events planned for next semester. There's also, like I mentioned, I'm here and I can meet with students during regular 9 to 5 school hours. I'm just saying because that's my work hours. Um, and we also have timely care. So students have access to virtual. For example, if someone's like, hey, I'm not there on the days or hours that the wellness counselor is there, but I want access as well. As I mentioned, well, I did not mention this. It's free to see me as a CT State student, as well as timely care is free for students as well.
Do you ever not feel comfortable helping someone and what happens?
Mm.
Do I ever not feel comfortable helping someone with what was it, Elena?
And what happens?
So far in my experience, I have not. Kayla, that is a really good question. I think Elena and I were talking about this the other day, right? Like based on my previous experiences, I've worked with people with pretty traumatic experiences. I've interviewed people on lockup, so I think I haven't had that experience. I mean, to answer your question, there are some students that um, they may need a higher level of care, right? Like maybe depending on their needs, they may see, because as of right now, a student can only see a wellness counselor 7 sessions in a semester. That's about, give or take, 2 times a month. Some people, depending on their needs and level of support needed, they may need to see someone weekly. They may need to be in an intense level of care where they're going to groups 3 to 4 times a week. So in that case, they would see me for intake, and then I would provide them resources and refer them out.
Point.
Is there a protocol that you can make sure that they get help or is it on them?
So I usually, thus far in my experience here, I have referred them and then I'll still meet with them until I know for sure they're connected. But the student has the right to say yay or nay, right? Like I can't necessarily force them or walk them to their appointment, but to have like a warm handoff, I like to meet with them until they're connected to those services.
Kinds of accommodations are commonly provided for students with mental health conditions?
Hmm, great question. So it again, it's an individualized experience. So we're really meeting the needs of students. And so depending on what they're struggling with, right? Some students like have immense anxiety when it comes to taking exams, right? Or they get very easily distracted and they get in their head. And so, very common for students to receive is extra time for their exams and the ability to take their exams in a reduced distraction setting, right? For other students, that might mean like in the classroom they might need to take breaks, and so they might have preferential seating in which like they can easily walk out of the classroom without disrupting the rest of their classmates or their professor, regroup and then rejoin the class, right? For other students, depending on the severity of their mental health diagnosis and impact, they might be needing flexible deadlines or flexible attendance in those moments where they're in crisis, right? So it again, it depends on the students, but those are typically ones that we have identified with students. Some might need, an alternative assignment if it's something that's triggering their mental health challenges, and so again, it'll be individualized. Great
What if
question.
they don't have a diagnosis but still need help?
Hmm. So I believe like CT State works really hard to meet students where they are. We understand that not everyone is going to have access or a diagnosis, and so we will work with them to identify what are strategies that they could use. So even if they're not getting accommodations, what are some strategies that they could use? What are some safe places on campus that they can turn to for support in the moment? So that's kind of where we'll meet them. Again, depending on the severity of what's happening, there are some students who walk into our office and their self disclosure or things that have been going on campus, it's pretty obvious that even though they don't have a diagnosis, they might be identified as someone, perceived as someone with a disability. And then we would work with them on identifying some accommodations, even if it's just for that semester while we're referring them to get some additional supports, whether it's through Michelle's office or through Timely Care or a community, agency.
Do you see a higher demand for mental health accommodations among neurodivergent students?
Hmm, great question. So I think when we look at neurodivergent students, oftentimes there's like a dual diagnosis of, with mental health diagnosis, right? Whether that's depression, anxiety. Some would say that that stems from having to navigate a world that doesn't quite understand them, right? Or
Mhm.
having to mask, right? And so that really takes a toll on people's mental health. And so oftentimes, yes, we do see that there's kind of a correlation there.
When a student is experiencing a mental health crisis, what immediate steps should they take?
So, if a student is on campus and they're experiencing a mental health crisis, the goal is to see me or see a staff, whomever that can connect them and walk them to me if they're currently in a crisis. If for some reason I'm not available or on campus, they should call campus police. And also, 988 is a great resource. So if a student is experiencing a mental health crisis not on campus, the best way is to call 211 or 988. The difference between 211 and 988, 988 is specifically for mental health crises. A lot of times it's perceived as if someone is having thoughts of suicide. No, it's actually with 211, you can call 211 for many different resources. You can call it for housing, you can call it for childcare, you can call it for health insurance, mental health. And if you're experiencing a crisis, right, trying to figure out which prompt do I press to get to the right people, it's best to just call 988. The key difference with 988, you can be in North Carolina and call 988. It's like 911, but for mental health specifically.
Mhm.
Why?
For why is 988 associated with mental health?
So from what I understand, Kayla, it was ruled out.
No, no.
Okay,
Okay, sorry.
thank you, Alina.
Why separate from 911?
Mm,
Oh, so from what I understand, Kayla, 988 has been ruled out, give or take, nationally, give or take about 3 years now. So what I saw in the news initially was a lot of people, including myself, if you see something, right, and you're in a state of emergency, most people think to call 911. Not a lot of police or all police are trained to navigate someone in a mental health crisis. So 988, uh-huh. 988 connects you to staff, the local crisis team from when you're calling, and you can speak to someone over the phone, right? A lot of times people have this misperception. If you call 988, you'll go to the hospital. Same
mm,
thing with someone is a mental health crisis. If they can see me, that doesn't necessarily mean they need to go to the hospital. They just may need someone to help them do some breathing techniques and relax and let them process whatever they're experiencing in the moment. If they are having any thoughts of suicide or homicide, if they have immediate plans or access, then it depends on, as Elena said, right, it's an individualized case, so the goal is to always reach out to services immediately, and
mhm.
that that you're not alone.
Yeah. Having that trained person is so important.
We collaborate with external resources like 988 or local mental health services to provide support.
Absolutely. So I will say each part of Connecticut, the state of Connecticut, they have a what they call local mental health affiliate. So they call it LMHA. I don't remember all of which covers which region, but I can tell you about the ones that I've worked with. And you can also go on, I think it's 211, their website, and they'll show you which ones cover which region based on your town. So I am currently at CT State Capital. That's a community college campus, right? But the local mental health affiliate in this area is Capital Region. So Capital Region can provide, someone can go to Capital Region and go in for a walk-in Monday through Friday. Most of these places have walk-ins. You can go, I always tell people go, the earlier the better, bring your insurance card and your ID. And if you go early enough, usually they can accommodate you that day. I know in New Britain area, they may cover New Britain, Bristol, Plainville, other towns in that region, that would be CMHA. And like Enfield, Windsor, Bloomfield, there is CHR, Community Health Resources. And I think in East Hartford, it is Intercommunity.
Yeah.
Yep. But like I said, throughout Connecticut, there's different LMHAs. And that's where you can get like an individual therapist. Usually they like you to attend groups, and you can have a prescriber, so a psychiatrist that can prescribe you medications if that is something that you need.
Do they have mental health vehicles?
Mental health vehicles, not that I'm aware of. I know when I was on the crisis team, depending on the agency, they have vehicles for the staff so they can go out as soon as possible to assess someone out in the community. Those places that I mentioned, yes.
The mobile crisis units. Right?
Yep.
Mhm.
That is what I mean.
Yes. Yep. And each of those LMHAs have mobile crisis units. So when you call 988, they can talk to you over the phone. 988 will, the staff members at 988 is ultimately the same people do 211. As I mentioned before, it just gets you to them faster. They can talk to you over the phone. And depending on how long they've been on the phone with you, or depending on what that person says, that they will connect you to the local LMHA in your area. And then you can talk to someone and they'll figure out, this person is at imminent risk, which means immediate. We need to go out and assess them.
What kinds of mental health training programs are available on most campuses, and how do they help both students and staff?
So I'm not aware of any specific trainings, and this is where Elena will come in because I
Yeah.
am I am fairly new here. But some of the events that we've had, for example, Fresh Check Day, we do provide resources and letting people know how to put in a referral for someone. If they know someone is struggling and may need some assistance. Also, we have tabling events, so any and everyone can stop by the table and get some information. And I'll leave it to Elena to
Yeah.
answer the
So
rest of that.
historically, and this is something hopefully, we'll be bringing back this upcoming year to our campus, but across, various CT state campuses, there have been programs such as Question, Persuade, and Refer, or QPR, as well as first aid, mental health first aid. So these programs are to help the layperson, right? So you don't have to have a mental health background to identify someone who might be at risk of having a mental health crisis or being suicidal, and then feel comfortable enough in practice. How do I approach this person? How do I share my concerns and then get them to the appropriate professional, right? Because we're not saying we're going to train you so that you can counsel these people, right? You're not the counselor. But these programs have been offered here at Capitol as well as other campuses to both staff, faculty, as well as students. So the idea is that the more people who can identify those at risk and feel comfortable reaching out to them, the less crisis we'll have overall on campus, right? And the more open, the goal is to reduce stigma so that people feel more comfortable reaching out for help, because that's one of the key issues, right? We may have all the supports in the world, but if people don't feel comfortable using them, then how effective can they be?
Mm-hmm. Great point.
What is first aid for mental health?
Hmm.
So
Great. Oh, go ahead. Did you wanna share or?
I'll share a little bit. So what I know about first aid of mental health, I like it. And it has the perfect name because when we all go to, or people that go to first aid training, it helps you, as Elena mentioned, right? It helps you assist someone in a moment of a crisis and then get you to the professional, right? So with typical first aid and CPR, it helps you help in the moment until the medical professionals can get there. So with mental health first aid, it is usually an 8-hour training, or you can break it up in 2 days, and it gives you and helps you identify the risks, some supports, what else? Some protective factors, all the things and how to respond to someone that is experiencing a mental health crisis. I also know there is a separate one for teens.
Mm-hmm. Yes,
Yep,
there's
there's a
one for
teen
younger.
one, and then
Mhm.
there's a typical mental health crisis. So hopefully, whenever someone does receive it, they feel and leave a little bit more confident of like, okay, if I'm out at the grocery store and someone is experiencing a mental health crisis, I'm not going to turn the other way. I can assist because when I was in grad school, I attended the same training. And I felt really, although I was in school for social work, I felt like going to that training was really helpful because it helped me realize
Mhm.
it'll be a while before I'm able to provide service to someone as a therapist. However, with this experience, I can assist someone in an emergency.
I would encourage folks to look in their area too. So even if they're not being offered on campuses, a lot of times you can find free classes in your community, whether it's a
Yep,
church or a local organization that's
yep,
offering it. Sometimes hospitals will even offer it. And again, these are free classes. So it's something that, just like first aid, where you want to kind of refresh yourself every couple of years, you can also do that with mental health first aid.
absolutely.
How can colleges foster a culture where mental health is openly accepted and supported?
Mm.
By the events that we host, right? And
Yeah.
interacting with people, letting people know that the resources are there. But as Elena mentioned, we can have all the resources, but if people don't feel comfortable utilizing them, I think it's really important to engage people and build relationships with people. When I first started here, I would say a week in the first week of the semester, people didn't know who I am. It was like a meet and greet. And then you'd be surprised the people that came to me later. I was like, oh, I met you at the table when you were downstairs on the first floor.
Mhm.
So building relationships, not just in a moment because I'm new, but throughout. And on a college campus is super important to show up to things that aren't necessarily mental health related, so people can be familiar with you. And it also shows that you're engaging with me because you're interested in my overall well-being. So like going to a musical event, or just going to other on-campus activities, not just mental health related.
I think that's where like the mental health coalition on each of our campuses really plays a role because you'll have folks from all areas of the college. Be- what I would say is mental health shouldn't start and end with just Michelle. She is not the sole kind of responsible person for student mental health, right? So having a mental health coalition and programming and doing a lot of outreach with faculty and staff to better support students, everyone plays a role, and that leads to a campus culture of care and concern, and hopefully we're reducing the stigma so students feel comfortable in our environment, and when they have a need or they're in a crisis, they feel comfortable enough to come forward and seek out the supports.
How do you support the emotional side of asking for accommodations, especially when students may feel shame, fear, or hesitation?
Oh,
I know
that's a
on my
great point.
It
Go ahead.
is. On my end, when I have a student come in, one of the questions on our survey when they make an appointment, are you a part of accommodations? Also, depending on what the student is telling me in that session or that intake, I'm going to ask them, have you considered, or do you know Miss Helena? And like, oh yeah, no, or I've seen her around. Because I'll ask, because I think that is a great way, depending on what they're saying. Most students probably could benefit or utilize accommodations, and most of
Mhm.
them already have it and they're connected. But
Yeah, I think that's kind of one of my areas that I kind of like find my groove in, right? When the students come in here and you have that like really hesitant knock and they look like they're kind of embarrassed, they're looking around, who's seeing me walking into your office, that kind of thing, right? And so I try to make my space welcoming and inviting. I talk to them. I think a key part of that is the educational piece. So the student is always feeling like you're in the driver's seat. So I will never share your diagnosis with other folks. You have confidentiality in this office that I hold strongly. Um, and I teach them how they can advocate for themselves. So hopefully, we're working on that like stigma reduction, and normalizing some of their experiences, because I think a lot of folks feel like, oh, I'm the only one, or I'm going to be, like singled out. And so I really a big piece of when I'm working with a student is that educational piece. Like, what is the experience going to be like for you? And then you have complete control, so you can ultimately decide who gets to know that you need accommodations and not. I think that's huge for helping reduce some of that anxiety that students feel when they're first coming to our office.
If a student is struggling but doesn't know where to begin, what's your best advice for taking that first step?
Hmm. Well, building your social network, period. That's just a life lesson, right? And so, whether it's your friends or your classmates or a mentor, here in the college environment, there are some really amazing faculty who students feel really comfortable with, um, advisors, right? And then even just making it out to a lot of the campus events that are meant to introduce students to resources, right? There's like student orientation or student convocation, or like the resource fairs that are on campuses. That's a really great way for you to, in a low stakes environment, learn about the resources, and in a time when maybe you don't necessarily need them in that moment, but learning about them when you're not in, like the thick of it and you're not stressed out is really helpful because then if you do need that service later on, you're like, oh, I remember that lady. Like, what was her name again? Or she said she was in the equity center. Like, maybe I should just stop there. I think that really kind of just opens it up. So just being open to attending different events and meeting new people on campus is a huge part of that. I don't know if you have anything to add to that, Michelle.
No, you aced that one. I agree.
It was great to have you on.
Thank you for having
Thank you,
us.
Kayla. Yeah, this is great. I love your questions. It
Yes.
really got me thinking. So thank
Mhm.
you.
Yes,
Thank you for
Kayla, thank
doing
you so
this with
much.
me.
Mhm. It
It
was
was
my
a
pleasure.
pleasure. Yes. And keep up the great
Please
work,
share
Kayla.
this talk show with your family, friends,
Yeah.
students, and colleagues. Everyone
Will do.
watching, don't forget to like, follow, subscribe, and share on Facebook, Instagram, and YouTube.